Hi, my name is Tim Dellit. I'm the interim CEO for UW Medicine and interim dean of the UW School of Medicine. So I grew up in a small town in Iowa, right on the Iowa-Minnesota border. It's a farming community of about 1,500. And where I grew up, I graduated with 49 students in our high school. It is a community where you learn the importance of hard work, honesty, being straightforward, and helping your neighbor. This is a very interesting time in medicine, and particularly for UW Medicine, as we continue to try to emerge from the pandemic. And I don't think we can underestimate the significant toll these last 2.5 years have had on all of our employees, our clinicians, our faculty, our staff, our trainees, our students, just a tremendous toll on the overall healthcare environment. At the same time, we have seen increasing capacity challenges within the hospitals with high census. We have had staffing challenges, which again are not unique to UW Medicine, but we're seeing that nationwide. Overall, I also am quite inspired by what we have seen and how we have responded on behalf of our patients, our community. Our people are phenomenal and have done just an incredible job over these last 2 years, but we have challenges ahead. First, we have to focus on the well-being of our employees, the resilience of our employees. We have done this throughout the pandemic through things such as our peer-to-peer support program, focusing on available mental health services. We have done weekly town halls through much of the pandemic as a way to really openly, transparently communicate with our employees and address the questions that they have. Again, we have to create an inclusive, supportive environment for our employees so that they want to stay here while we continue to recruit the outstanding individuals who want to join the UW Medicine family. Our short-term priority has to be our people. Our people are our greatest resource. They are the foundation upon which we have to be able to build our outstanding clinical education and research programs. Without our people, that simply can't exist. And so the well-being and resilience of our people has to be our number one priority. We also have to continue our efforts around equity, diversity, and inclusion, and creating an inclusive, welcoming environment, both within the learning environment and the work environment. We also have significant challenges. We have capacity constraints, both in terms of beds and OR capacity. We have staffing challenges that we continue to have to address. For our patients, we have to improve access to care. We have to continue to improve their experience as they receive care within our community. We also have efficiency areas. We have length of stay challenges, and by that I mean that often, unfortunately, patients, even when they are medically ready to be discharged from our hospitals and go to that next level of care, we aren't able to do that in an efficient manner. That impacts our access and being able to bring in other patients who really need our care. So those are just a few of the things that we have to focus on here in the short term. I came here 21 years ago for my infectious disease fellowship and stayed here because of the people and the mission to improve the health of the public. We have seen that lived out over the last 2 years and this unique and significant role that UW Medicine plays within our community. When we saw limited access to testing or vaccinations, particularly in our communities of color that were disproportionately impacted by the pandemic, we worked with our community partners, we mobilized vans, we set up pop-up clinics to help bring those resources to the community. That is what makes UW Medicine special, and it's the people who are the foundation, and that is why I stay and why I come to work every day inspired.